Thank you. Welcome, everybody, and congratulations on your pregnancy. Has anybody got babies already? No. Yourself? Wonderful. Everyone else pregnant? Great. You're in the right place. We've got a boob and a baby, so you're definitely in the right place. So congratulations. And what we're going to talk about today is about 20 minutes, just looking at basics of breastfeeding, what to expect for the first few days, and the importance of skin to skin and learning and connecting with your baby. So these things take time. And most people look at the birth in their pregnancy, and it's afterwards that they start to really think about breastfeeding. But people are really passionate and want to make it work for themselves and want to make sure that they've got the right supply and that they're feeding their baby. So it's absolutely important for you to take the time in your pregnancy to learn more about breastfeeding. So I work at the Martyr Mothers, and I'm a lactation consultant. We've got a support centre, and it's a group of lactation consultants that support the midwives. The midwives are all fully trained in breastfeeding, and we help and support them with education. And we run breastfeeding talks and feeding clinics 6 days a week, so we have Sunday off. Yay! And we help and support you as soon as you deliver your baby. Okay? So I've got some giveaways, lots of giveaways. So I'll ask some questions along the way and shout out some answers, and whoever's nearest, I'll give you a giveaway. And if you want to ask questions at the end, feel free. If it's something that is more in depth, then come to the stand. It's at M29 if you've not been already. And you can meet myself again and Jenny, who's one of the midwives and lactation consultants, to come and ask some more things before you leave. Okay, all right, let's go. Skin to skin. Has everybody heard about the importance of skin to skin contact? Yes. Okay. So skin to skin is so beneficial for you and your newborn. And skin to skin, what it means is that the baby has nothing on. Pop a nappy on, otherwise you'll get the first meconium poo all over you. But it's everything off the baby and everything off your chest. And you're lying your baby between your breasts and having them up next to you. So the benefits of doing skin to skin is that you connect with your baby and you start to read and learn what it is that they're telling you. Are they hungry? Do they just need a cuddle? They also regulate their temperature and it regulates their blood sugar levels. So when they're newborn, it's really important that they're nice and warm and their blood sugar levels are adequate so that they can think about breastfeeding and breastfeed well. They're swaddled in the cot. During the day, they will sleep. They definitely feed more at night. So the more during the day you lie back and have your baby on you, next to you, then they can start to think about, what do they want to do? Are they wanting to feed? So remember that benefit of skin to skin, that you can start to look and see what is it they're telling you. Are they hungry? Guys, you can do no, you can't do breastfeeding, definitely not. I learned that when I did my qualification for sure. But you can definitely do skin to skin. And skin to skin, you can give the same benefits with the temperature regulation and the blood sugar regulation. But it releases some good hormones, you know, your oxytocin that you need for birth. You produce that when you have your baby next to you, that love hormone. And so guys, you do that as well, but it reduces your stress hormones so that you're nice and calm and the baby is automatically calm. And when we're with you on the postnatal ward, you'll be saying to the midwives, why is it that my baby's nice and asleep here? As soon as they go down the cot, they cry. You've got to think about where they've come from. They've come from inside your tummy and they've been tightly enclosed. And suddenly they're in this new environment. So the more that they're with you, the more that they adapt to their new environment, and the more they're up here and they can calm themselves down and be feeling nurtured and safe. You definitely can't spoil a newborn baby by going up to them and having them cuddled with you. Actually, you'll respond quicker. Okay? Let's go on to the next slide, which leads nicely into feeding cues. Can anybody tell me what they think a feeding cue is? There's a prize in it. Crying. Are you serious? Yeah, no, definitely crying for sure. Crying is a feeding cue. Crying is a late feeding cue. So actually they do start to tell you before they cry that they're hungry. And most of the times it's just when they're awake. So as they start to wake up, the first feeding cues are looking more alert. moving their mouth around like a little bird, and hands starting to come up towards the mouth. So, but we teach swaddling because we want them to settle and go to sleep at night. And so during the day, if they're swaddled up, how can they get their hands up? So by the time that you've unswaddled them, they're crying because they feel their arms loose. They can't feel where you are. So remember that skin to skin and keeping you close during the day, and you can catch those feeding cues early because remember they're next to your skin, so they can smell everything and they can see the areola and they can smell the amniotic, the colostrum, which smells like amniotic fluid. Research has proven that colostrum has the same taste and smell. So remember that that's how they know where to go. So as soon as you have them in skin to skin up against your body, they will start to bob and search and look. That's a feeding cue. Okay? Don't worry if you miss it and they're crying. So just pop them up here. They will calm down. Then you can start to think about attaching and feeding. Okay, so feeding cues are really important to catch early so that they are calm and can attach well. Okay, so who answered that question? You answered that question. What would you like? Would you like a swaddle? This one here? This is a lullaby CD. There you go. Okay. Has anybody heard about baby-led feeding? No? Okay. Baby-led feeding is based on biological nurturing. And really what it looks at is baby telling you that they're hungry and your baby starting to look to find the breast. That's about it. But we teach this in the hospital to really calm the babies down so that they can start to look with a wide mouth, bob and search for the breast. And we know the more you lie back with your baby on you, the more they can use your body to lift up and bob and search. Okay, so really that's the basics of baby-led. It has other benefits, which is that as they start to bob and search, if they attach in an upright position with you laid back a little bit, then the milk goes through to their stomach in an upright position, so it's a lot more comfortable for them. So there's lots of benefits of them leading the way. And really, it doesn't matter which position you use. You'll be Googling lots of different things in your pregnancy about the football, the cradle, the cross cradle. It really doesn't matter how you hold your baby. You can come over this way. It really doesn't matter how you position your baby. It's are they attaching well and are they drinking well? So baby-led is beautiful because it has your baby with you. You start off here, you cue into what they're telling you, and they will start to search for it. And what it does is it means they have a big wide mouth, which is what you need for attachment, good attachment, wide mouth. And you cue in and naturally start to move them down towards the breast. And you can then move them down towards the cradle or underneath or up and down. Okay? How you attach your baby is according to whether you've just delivered, whether you've had a cesarean, the size of your breasts, the size of your nipples. It really doesn't matter what you've got going on because they take time and they learn, and your baby is your baby for your body. So of course they can attach to your breasts. Most people worry about, are my boobs too big? Are my nipples too long? Is this going to cause a problem? Don't worry about that kind of stuff. We will guide you and the midwives will guide you as to what a good position is according to what's happening that day. Are you uncomfortable? Do you need to lie in bed? Do you want to sit down in the chair? Okay? There are lots of different positions to try, but remember to try and practice them here so that they lead and you work with them together. Okay? How we work in the hospital at the Mater is we work with the midwives. The midwives give you all the care 24 hours a day. And we provide breastfeeding talk and feeding clinics every day, like I said, apart from Sundays, where you can practice a dedicated time to practice different positions and ask us questions along the way. Any questions about baby-led? No? Is it all making sense? Cool. Okay. Okay, first few days. Question for a prize. What do you think is the average number of times the baby will feed in the first couple of days? So we're going to go for, say, 1 to 3, 3 to 5. Nobody? Nope. 5 to 6. 5 to 6. Okay. 7, 8. 8 times. More? More times? Okay. More than 8 times. Okay. All right. So we've got a variety. So they do. Some babies will feed not very much and they'll sleep a lot. And some babies will feed a lot. Okay? They have a job to do for the first few weeks. They need to build your milk supply. And the only way they build your milk supply is by removing the milk. Okay? So sometimes most babies do an awesome feed straight after birth and then they sleep. A big sleep period. And they're just not doing a whole lot. And so what you do then is work on your supply. We teach you hand expressing. We teach you how to keep going with producing milk. And the most common concern that women say is, how do I know I've got enough milk? And especially when your milk's not quite in yet. How do I know my supply is going to be okay? It's the biggest concern for women because you want to feed your baby. You can see in a bottle what you're giving your baby. How do I know what's in my breast? How do I know that they're getting enough? And so remember that automatically as your placenta is delivered, that triggers your colostrum to be made. So that's done. Then by keeping making milk is by removing milk. So they need to feed. They have to feed a lot. So therefore, your body will know and go, okay, I know how much milk you need me to provide for you. And it automatically works. Trust in the system. And if they don't feed and they're really sleepy, remember hand expressing. And the midwives can show you how to hand express, how to store it, how to feed it to little baby so that it's still promoting them learn to breastfeed. And remember Skintoskin so that you can catch those feeding cues. Okay. So sometimes they do feed up to 12 times in the first 24 hours. And often beyond that, it's normal. Remember how many times we eat and drink. And breast milk is food and fluid. So sometimes they might just want a little drink. Sometimes they might want a big meal. So there's no schedule to it. Okay, so change your expectations if you're thinking of a certain schedule for feeding. Be with them. Make sure they're feeding well. Set up just them with you and respond to what they're doing. And that will help your supply to be sorted. Okay? First few days also. So we've got some prizes to give out, sorry. We've got 8 times, more than 8, 6. Perfect. What would you like? Blanket. This is a baby swaddle. There you go. Same. Awesome. That's okay. And yourself? This one? There we go. Okay. The other thing is you're expecting our wheeze and poos, little small wheeze, lots of thick tar meconium, and then the poos and wheeze changing. So the wheeze increasing and the poos changing from the tar to the brown to the green to the yellow. And the midwives will give you nappy charts in the hospital so that you can track yourself along, check that your baby's getting enough milk. Okay? You expect them to cluster feed a lot at night. They don't have our body clock. They feed a lot at night. And they need to do that to build your supply. So respond to their feeding cues, feed, get some sleep during the day. All right? And they need to do that job to get your supply going. Okay?
And is that enough then for the growth spurts so that will build enough supply for?
Yeah, so for the growth spurts, thank you for your question. The question was about, is that the same for growth spurts? So growth spurts are at different stages along your baby's breastfeeding journey. And when they need to put on more weight, what have they got to do? They've got to feed more. They've got to tell your body to produce more. How does somebody with twins feed enough compared to somebody without? How does your body know? Hormone and milk removal. So when they need to gain more weight, they feed more frequently. And we often get phone calls in the breastfeeding support center saying, I was going great with my breastfeeding and my baby is feeding like mental. Remember, they need to do that so that your body then produces more. They gain weight, the feeding settles down. Okay? All right. I do this talk every day and it's 45 minutes long, so it's really hard for me to do this in 20 minutes. I could talk for hours, so I'll hurry along. I think I've got 5 minutes left. So demand feeding, we kind of talked about, it's responding to what the babies are telling you. Remember schedule feeding. Sometimes you might miss the feeding cues, so they might not attach so well. And again, further down the line, really be dictated by your breasts. Are your breasts full? Feed your baby. Because if your breasts are full, they need to be emptied so they refill, and preventing infections and mastitis. And okay, so demand feeding means baby here, respond to what your baby is telling you that they want. Okay. Biggest thing, how do I know that my baby's getting enough breast milk? You know that they're mainly settled, mainly content, that they're attaching well, and that they're drinking well. And we'll teach you that when you deliver. We'll teach you how do you know that they're drinking well and they're attaching well. And wheeze and poos. So lots of heavy wet nappies, lots of yellow poos, and gaining weight. So good weight gain. So it's a whole picture of a baby. That's it. You can definitely tell that your baby's getting enough and that you've got enough milk. Okay? There are so much help out there for feeding. So the Australian Breastfeeding Association has loads of information online, and you can join mothers groups. But there's lots of free information about average number of feeds, which is 2 to 12, and output and signs of different problems throughout pregnancy, when it doesn't work out, what to do when you go back to work, all those kind of situations. And the Martyr Mothers, we have on our website, we have lots of brochures, lots of information about breastfeeding. And you can contact us at the Breastfeeding Support Centre, and you can see us antenatally, and we can have a chat with you. We've got a free group session where we talk about breastfeeding. And afterwards, we support the midwives on the ward. We do the breastfeeding talks, the feeding clinics, and we offer a private consultation service. So when you go home, if you're still experiencing problems with breastfeeding, anybody, whether you delivered at the Martyr or not, can come and see one of the lactation consultants for a private one-on-one. And then we bring you back in a follow-up group just to check how things are going. 1300 Health is a great service that you can phone 24 hours a day. And your local child health clinic offer free early feeding clinics. So that's child health nurses are nurse and midwife trained, and some of them have lactation qualifications to support you with feeding. They weigh the babies with you, they track the baby's development with you, and they check how your feeding's going. Okay, so you'll get all that information when you deliver. Family and friends are the most important supportive network that you need. You need everyone to be on the same page with you as to what your goal is with breastfeeding, and support you at those times at 3 a.m. when the ABA gets the biggest hits on their website and everyone's Googling away, is this normal? What am I doing? How do I know this is going well? So that dads have an important role to help and support you, and learn baby bathing and nappy changing, and foot massages and neck massages are really, really good for breastfeeding mums, I've heard. And build a good relationship with your GP so that you have someone that you trust. And that's the thing about breastfeeding. You need to build trust within yourself and trust your instincts, and have somebody there with you that you trust as well, and the advice that they're giving you feels right. It takes time. It takes time with breastfeeding. Remember, the first couple of weeks, they need to put their birth weight back on. They need to feed a lot, but they're meant to do that. They don't come with a schedule unless they're a vulnerable baby, then they need to schedule. But otherwise, you need to have them with you, respond to them, learn from the midwives and from the lactation consultants. And I promise you, it's very, very rewarding. And there's plenty of people there to help you along the way. And just call us if you ever need anything, and if you've got any questions, you can ask away now. Otherwise, you can see me and Jenny on M29 stand, and call us if you need anything. Okay, we've got some more prizes to give away, so I'm going to ask some questions. All right, what question can I ask? How many wet nappies do you think is normal for day 5? 12 wet nappies? Okay. Any higher, lower? 5 wet nappies? 10? 10? Okay, so we've got, who said 5? 5. So 5 or more. So 5 is the perfect one. The reason why we say stay at 5 is because if you think 10 and you get 5, you're going to worry. So 5 is absolutely adequate. And you don't have to be obsessive about it. Like, you don't have to count every single nappy once you get beyond day 5, but it's good to count them before. So prize, would you like a reusable coffee cup? Would you like a blanket? Would you like a lullaby CD? Blanket, of course. Okay, can you pass that back for me? Thank you. All right, so time's up now. I will take these back to the stand and come over and see us, ask questions. And I hope that that was helpful for you. Yeah, thank you very much. Thank you.